Healthwise, brought to you with the compliments of ICBL, always there when you need us most. Hello, good evening. Thanks for joining us for part 2 of our look at sickle cell disease. Last week, we told you that sickle cell is a condition passed on from parents who carry what is called the sickle cell trait to their children. That is, if both parents carry the trait. In certain parts of the world, newborns are routinely screened for the condition, but that test is mostly done only upon request here in Barbados, where it is confirmed that either parent carries the trait or if the child shows symptoms.
Symptoms usually show up in children from about 6 months of age. That is because the hemoglobin that we are born with usually starts to go down, what we call hemoglobin F, or fetal hemoglobin, that starts going down, and therefore the sickle cell anemia hemoglobin is what starts coming up. So at around 4 to 6 months of age is when really the baby starts showing symptoms. They get swelling of their hands and feet. They can't tell you that they have pain, babies, but they can get pain, they will be irritable, and sometimes their organs can be enlarged, like their spleen and their liver.
As we mentioned last week, the pain is, in most cases, the worst part of having the condition. It's been described by some patients as the equivalent to having the pain of childbirth, but lasting constantly.
It can last anything from minutes to weeks, and it can be very debilitating for some patients. And the other part of the problem with the pain is that pain is very subjective, and because a lot of these sickle cell patients usually have a lot of chronic pain, or they're always in pain, their affect in pain is not like us. If normal people, when they get very painful things, like if you have surgery and you have surgical pain, that lasts for a while, and we know about that. But these people getting pain all the time. What was described to me by the patients is like if you hit your funny bone, what you call your funny bone, and just think of that and lasting for days or weeks at that same intensity.
Now, because of that intensity, treatment consists of prescribing narcotic drugs.
Because what we commonly use is something like morphine. There is something out there that says when you're taking morphine, a lot of the older people think that is like the end of life, okay? But they have to use this to control their pain, and it controls it. It doesn't get rid of it. It just puts them at a comfortable level. It doesn't really get rid of it. And because of that, they are prejudiced, because a lot of the time the healthcare professionals do not believe them about the pain, and because they are on morphine, and because they are living with this pain, they know what works, and they will tell you what works for them, and some of them would even know the dose that it works at, and they will come and tell you. But because of human nature and how we are as healthcare professionals, we will just think that is because the patient is asking for it because they want the high from the morphine or so. And
that's tonight's program. Next week, we'll wrap up this series by hearing from a young lady who has sickle cell disease. Thank you so much for joining us. Good night. Healthwise, brought to you with the compliments of ICBL, always there when you need us most.